Hi everyone, I'm Dr. Jay Birch. I'm from Team Healthcare Clinic. I wanted to show you two different ways that we adjust the lower back. We adjust here, we're going to do a quick little assessment. Before we would treat somebody, we would first do a history and then we would do an exam. And now we're going to do an assessment of exactly what areas that need to be adjusted. So you can go on your stomach here, and get out of the picture. And we do palpating, we just first find out where some of these vertebrae may be out of position. Once they're out of position, that affects the nerves that go to the muscles, and so you can see a change in their strength. So we palpate for that, which I had done with Jess earlier. Then we're going to check her flexibility. So she's going to raise one leg up as high as she can. She's got very excellent flexibility. The other side we found not so good. And that can be an indication of a misalignment. So we're going to show you one of the techniques right now. So she's going to lay on her right side and she's going to face, I'm going to get in front of the camera for just a second. I'll show you how this works. We get her set up just right. We'll be using her leg as a lever, and then I'll do a little twist move so that we can adjust this vertebrae back into position. Just like that, nothing too forceful. She can go on her stomach. It goes really nicely into place, and then we recheck. So raise that leg up, and I want this one just like it, and there we got it. There is another technique. Some of you, this style of adjustment would not be the right thing, so we use another technique called an activator. This is a spring-loaded instrument that uses a high speed but very low force adjustment. And with that, we can palpate, find some misalignments, and then with my activator, adjust her that way. It's very gentle. We'll use it on babies, on many elderly, and then just for other people that just prefer it. For some, it works the best. So those are our two techniques.